Welcome to the third video of my ankle recovery series. In the last video, I talked about the factors you might want to take into consideration when deciding whether ankle surgery is going to be right for you. And in this video, I'm going to focus more on what to expect before, during, and after ankle surgery to really give you an idea of what to expect going through this type of an experience. And the number one question I want to focus on at the end of the video is whether or not you're actually able to live and recover on your own following an ankle surgery. So let's talk about what to expect before surgery. If you have decided that surgery is right for you, the first thing that you're going to want to do is get that surgery scheduled. And the reason for this is because the day of the surgery is really your first day of recovery. So the longer you delay that surgery, the longer you're delaying your recovery. Once you have that surgery scheduled, the doctor is probably going to tell you that you can expect 3 different invoices leading up to that surgery, and you're going to be contacted by 3 different offices. The first office is going to be your actual orthopedist office. The second office is going to be probably the surgery center, and then the third office is going to be the anesthesiologist. So you'll get 3 separate phone calls and 3 separate bills as kind of pre-meetings leading up to the date of your surgery. Before your surgery, you're also going to want to pick up your medications. If you have been prescribed antibiotics or painkillers, the less that you have to do the day of the surgery or immediately thereafter, the better position you're going to be in. So I made sure to go ahead and pick up my prescriptions prior to my surgery. I also wanted to talk about 2 pre-op requirements that you'll probably have to follow as well. One, depending on the time of your surgery, on the day of the surgery, you'll probably need to cut off your eating and drinking the night before. So for me, I had to stop eating and drinking everything after 10 p.m., which wasn't so bad because I usually don't eat that late anyway. And I pretty much woke up the next morning and got ready for my surgery and headed out the door. The other thing that you need to consider is filling out the paperwork beforehand so that things can go as smoothly and as timely as possible on the day of the actual surgery. On the day of the surgery, I was also required to coordinate transportation to and from the surgery center. This is pretty common and probably something that makes sense. If you are having ankle surgery, it'll be pretty difficult to be able to drive yourself back anyway, especially considering the potential effects of the anesthesia. So I was able to get a ride to and from the surgery center. And interestingly, they said that I wasn't allowed to do rideshare or a taxi, which kind of made no sense to me, but something else that you might want to keep in mind. I was instructed to arrive at 8:45 a.m. and I think it worked out well that my surgery was earlier in the day, because from what I heard, if a surgery is kind of later in the day, then a lot of stuff can kind of go wrong and delay the timeline on the day of surgery, causing you to wait an excessive amount of time while you haven't eaten anything all day. Or on the other hand, you might actually be called in earlier, even if your appointment was not until later in the afternoon. If the doctor is running ahead of schedule, there's always the possibility that they'll call you in earlier as well. So definitely better to opt for a surgery time earlier in the day, if at all possible. Once I arrived at 8:45, I checked in with the front desk. I finished off any remaining paperwork that they had for me, confirmed that the payments were all set, and then only really waited in the waiting area for a few minutes before they moved me into kind of a holding room that had a bunch of different beds for a bunch of different patients. I met with a few nurses, including the OR nurse, the operation room nurse, and then also met with the doctor briefly, as well as the anesthesiologist. And they had me change into a patient gown that I'll show you here. They shaved my ankle, that I'll show you here, and they labeled my ankle to make sure that they performed surgery on the right leg, which is always super clutch. I'm glad that they got the right leg. And then they set me up with an IV, which again, all of this is pretty standard pre-operation procedures. I think it was around 10:15 in the morning when they moved me from the holding room to the operating room. Just for awareness, the operating room is often very cold. I wasn't particularly uncomfortable, but I've heard that from other folks. Not that there's a whole lot that you can do about that because you're just in your patient gown anyway. Before they activated the anesthesia, they had to activate a nerve blocker, which would numb my lower right leg so that after the surgery, when I came out from the anesthesia, I wouldn't be in excruciating pain. And so that nerve blocker lasts for about 12 hours following the surgery. That actually makes it really comfortable post-surgery, and the pain doesn't actually start to set in until that nerve blocker starts to wear off. So after they gave me the nerve blocker, they gave me some other kind of drugs to calm me down, and you know, I started feeling a little spinny and kind of warm and comfortable. And then they started the countdown for the anesthesia, and before I knew it, I was under the knife, and the next time that I was awake was after my surgery. And the last area that I want to touch on is what to expect after surgery. So after my surgery, I didn't feel many of the effects of the anesthesia. Of course, I was a little bit loopy as soon as I woke up, a little bit disoriented, but that honestly went away after 5 to 10 minutes. And luckily, I didn't feel any adverse side effects from the anesthesia, although the doctors were very concerned about that, and apparently anesthesia impacts can vary significantly from patient to patient. I felt pretty normal after a few minutes, and even though my ankle was really messed up, like I definitely could have driven home if I didn't have an ankle issue. But obviously it was good that I had a ride home from a friend. But like I said before, because the nerve blocker wasn't going to wear off for about another 12 hours, I really wasn't in any pain following the surgery. I felt totally lucid and normal. I was acting totally normal, and I was very relieved after the surgery that I wasn't like totally in shambles or in extreme pain or anything like that. Like I said at the beginning of the video, I want to talk about the biggest concern that I had before the surgery, which is, am I going to be self-sufficient after the surgery to be able to live on my own? I normally live on my own. I'm on the second floor of an apartment complex that doesn't have an elevator. So I had asked doctors before the surgery whether it was realistic for me to be able to recover on my own. Generally, the answer that I got was yes, but it was very uncertain. And I guess I understand this because it's going to depend on how the surgery goes, and it's going to depend on your own personal fitness and level of independence. But I will say that having gone through it, I don't think it's at all something that folks should be afraid of. It always helps to have the support of a friend or family member, and luckily I had that as well. But there's a lot that you can do to set yourself up for success, to be able to live self-sufficiently on your own following the surgery. I'm going to talk about that in my next video, the things that you can do to set yourself up for success following surgery, because when you're in that very fragile post-operation state, you really want to minimize your responsibilities in that time frame. You want to minimize work, you want to minimize having to run out and grab medication or supplies or groceries. You don't want to have to clean your apartment up or you know, take care of basic chores that you could have done beforehand. So I'll talk about that in the next video, but assuming you're able to do those things beforehand and prepare, there's no reason in normal circumstances, in my opinion, that you won't be able to live on your own and be self-sufficient following the surgery. So I hope this video was helpful in sharing a little bit about what to expect before, during, and after your ankle surgery. If you enjoyed the video, please feel free to check back for more. Best of luck with your ankle recovery, and I'll see you in the next one.